audience about the children that are diagnosed at age 3 and had no symptoms before. I can tell you that that happened also in the follow-up of baby at risk. If you look at that 25% that were diagnosed at age 36, more or less 50% had not been diagnosable at age 24 months. And we are talking about babies that were followed every few months regarding all the social communication and developmental aspects. So it's true that there are kids that develop the symptoms later. Why is that? Because the symptoms represent the development in the brain. And the brain does not, as Dr. Hosdiak explained, is not fixed from day one, but it evolves, matures, and sometimes matures correct, and sometimes does not mature correct. So my advice will be to say, first, it's true that these kids are. My advice will be to make, especially in those children, a good neurological evaluation. Because some of them, very few, but some of them have epilepsy. And epilepsy at that age is connected with loss of language and loss of relationship. So I think that will be a question to do in those kids that develop at the age of 3 or later on. In the old days, we used to have determined the issue of disintegrative psychosis or disintegrative disorder. But that was eliminated because we found that it was not frequent at all. Very, very rare, and always representing a neurological condition that could be diagnosed later on because of some kind of dementia in childhood or some kind of development in that. So I will say the majority of them develop the symptoms between age 18 and 24 months. Diagnosis usually is between 24 and 36 months. But the families had noticed, as I said to some of your colleagues, noticed the problem before the professionals. In fact, very often the families in Europe are said by the pediatrician and the nursery teachers, you have to wait. You have to wait because it's too early. And the families were concerned. And they were saying, I find this, I have observed the other thing. So we have to educate better the professionals, ourselves. Okay, let's talk about treatment. Treatment, the first thing, clear idea. There is not one specialist for treating autism. This can be challenging, but this is what we do. There is not one specialist saying, oh, I treat autism, oh, I treat autism. Autism needs a case worker. That case worker must merge the knowledge, the people, the practices. So you need a lot of information, but you need a case worker. And I always explain to the families the following. I tell them this is like an orchestra, exactly like an orchestra. In the orchestra, you need the conductor, the director, right? Like Semyon Bakov you have here. The director is important, but the director does not play the violin. It's the people who play the violins. So I tell the families, you need a case worker to make with you a program. But then you have to play. And the teacher has to play. And the people have to play, not the conductor. The conductor will show you, will see how you work, will tell you how to work, but you have to play the violin. So we have to teach you how to play violin for this child, okay? There are 12 principles that I will try to cover quickly. First, chronological age. Many of these children take a long time before they learn things. So you have to think in the time they will be older. and start soon to teach them things that will be useful when they are older. You must use the peaks, the benefit from the strengths. You have to teach something that is functionally in agreement with the context, with the function of the context. You must teach them how to use the tram that you use here in Prague. We don't have a tram in San Sebastian, so there's no way to teach the tram, no way, but you can show this. Incidental teaching means that you need to teach as the opportunity comes. You don't make the opportunity, you profit from opportunities. Task analysis has to do with behavioral therapy, and you break the task in small steps, and you go step by step. Usually starting by the end, and go backwards, so you finish well. An important issue has to do with environmental structure. The structure that was promoted by Eric Schopler in his speech program. You know that the first time I came to Prague was many years ago with Eric Schopler. And the two of us gave a course at the Institute for the Deaf Children in Prague. And he insisted on the environmental structure. The battery is running low. I close this. How do I close this? Michael, I need you to come here. You're running low battery, so I cannot read this. Okay, I go from there. Visual support. I told you many of the children are good in visual memory. So we use visual support, visual aids, and so forth. Augmentative communication, you'll find out later on about that. Social skills, partial participation, these are the principles that you find in the literature. Personal empowerment. Okay, let's see if I can work. Yeah, great, thank you. So remember the peaks and the mountains. When the children are young, we go from the bottom up. We promote development. When the children are in middle school, we look around and we see what the other children do and try to adapt the content of a curriculum for them and the support. And when they are older, we'll go up and we say, how is the tram? How is the funds here? What is the employment system? And we start from what is going to be needed up there and we go down. So young children, down, up. Middle children, around. And older children from up and down. Now, we don't use a franchise system. We don't buy in Benetton. You know what I mean? So we use everything. We benefit from multiple methods. We use behavioral methods. We use social communication methods, like the Denver. We use the TEACH program. But one thing helps in making an environment more friendly, like the TEACH program, structure, visual support. The social communication model helps us to use the skills, and the behavioral to learn the skills. And my suggestion, and the suggestion of our program, is to mix freely. We don't buy, we steal. From this, from there, from the other. And we profit from what is to be useful for the child and with the family, for the wishes and the goals. But keep monitoring outcome. The point that many families said, well, the child has 2 hours of speech therapy. for instance. I would say, well, if your child is going to learn German, will you expect the child to speak German with 2 hours a week of classes? For that child to learn social communication, play, autonomy is much more difficult than to learn German. So the hours are all the hours, all the hours. That's why we teach and we support the people that share the lives of the children, the teachers, the family, and the friends. And we say, all the hours are good. If it will be some time that the child is too tired, you leave it alone, rest. But then, later on, you go there. So we profit from natural opportunities and all the time that is available. Okay? Sometimes, in some countries, like in the States, it's the family that has the choice for the type of treatment that might have. And the goal is the cure of ASD. In Europe, it's the responsibility of the public authority, at least in Spain. It's not the responsibility of the patient to decide what to do. This is a public health issue. And if you have epidemics at the airport in Prague, you will not ask the people there in the airport, do what you want. But the public authority will say, we're going to do this and that and this and that. So that's what we did in Spain. Our National Institute of Health, and I was very supportive of this. In fact, I coordinated this project. We produced the guidelines for detection, diagnosis, research, and treatment. And the government said, this is the state of the art. And this is what we got to do. They are in the internet and they are free. But the point is that it's not up to the patient to get public money to decide what to do. It's the public authority, the one that says, this is what we do here. And if there is new evidence, we'll change that. There are many international guidelines, many. Very good, by the way. To treat, again, get to know the individual. To say that the person who has autism orients you, but does not give you the treatment. You must learn, and you use the systems that we use for children that have difficulties in learning, like all the adaptive skills, typical adaptive skills, communication, community, self-direction, health, so on. We are a network of services. So what we did to ensure complementarity is to use the computers. And we have the programs are in the computers. And it's very easy for the teachers and the workers to develop the program using what other people got into the project. In terms of outcome, this is important. 0.1% of our patients in 35 years needed institutionalized long-term hospital, psychiatric hospital. This is the lowest figure I have ever seen in the world. 35 years. Even in North Carolina, it's 7%, 0.1%. And we did that also collaborating with the Luxembourg government. And this is the minister, Marie-José Jacobs. And what she did was to get the people, the adults with autism, out of the psychiatric hospital and back into the community. And we did that in 2 years. Of course, Luxembourg has money, many money, and they supported everything. But it was possible to change. So you can do many things to get satisfaction. This is another point. This is the level of psychotropic medication in our program. It's less than 30% across all ages. In some parts of the world, it's 90%. In the United States, 56%. 27% was the last figure we had. And in children, 12%. So the vast majority of people are not taking medication. They have access to all these different programs. We have a structured pharmacotherapy system. It's called PharmAutism TR. And we developed this in conjunction with Andres Martin from Yale University. So it was a joint project. okay? And another thing that we did was to use the new technology. And you mentioned that in the beginning because we're very proud of it. This is a project that Emintza means e-language in Basque. Mintza means language. And this is a system that you can download into any tactile system, like big telephones, iPads, all kind of pads, and even computers. And you can select what you want and make your phrases, your speech. And this is to help children that do not speak or are learning how to speak. And then you touch and it says the sentence. And the sentence, you can make your own sentences as well. You can manipulate everything and get your own pictures, your own family, your own thing. You could even tape, record in Czech language, everything. This has been done also in Vietnam, where they put in the names and the words in Vietnamese. So it's very flexible. This system works in many platforms and software systems. Originally, it's in Spanish and Basque, French and English, and also bilingual. But I insist, you can put the sound that you want. We had real donated voices. They are not synthesized like the ones in the airport. And let me tell you, we had children and adults come in and to give the voice to the people that were not able to talk. And they were so proud. And we were so proud of having them taping the voice. The versions is for child or an adult, male and female. And it's very friendly. The only thing you need to know to manipulate the whole thing is to send an email. If you're able to send an email and attach a file, that's it. You don't need anything else. The system is very complex inside, but outside is very simple. And it's free. So you go to internet, to the Foundation Orange in Spain, and you get the download. And it's very good. You have a tutorial as well in YouTube of how to use this. We look for quality of life. There are instruments that will help you to understand what is the quality of life of the people. Supporting the person. Well, we are very interested in empowering the citizens in human rights. So these are the human rights that we try to follow in every unit. And now we are making this the beginning of our program. In other words, the human rights and all the workers have access to these materials on the internet, more than 5,000 symbols and other elements. Now we are changing the project to the life project. So we are asking, what is the vision of the person? What does the person wants to do? If the person cannot tell us what is their dream, we ask the legal authorized representative, the family, and the friends, and tell us what kind of life the person would like to have in the next 5 years, what like to do in school, what he like to do in transition to adulthood, what kind of life one adult. And we try to decide that. And we develop the life project for every person. But we start the life project with human rights, ensuring that we help the person to defend human rights. The right to communicate, the right to be safe, the right to this, the right to that, all the human rights. So that's important. Empowerment is very, very important. This is the article that we said before. I suggest that you read it. If you go to Google and you mark Fuentes 10 tips, you get the publication. It's free. It's the American Academy. And you get like an engine there that helps you to understand what language you want. We have translated the materials in 42 languages. To my regret, the language of Czech is not there. So I hope that we're going to have 43 very soon. That's your task, okay? I will support, and the American Academy will put the check in there, because we got all kinds of languages from the world, and we also have in pictograms. So I think that it's very easy to do it, so hopefully. So, in order to close, I'd like to give you a triple vision, as I said. One is the vision of autism. We know that autism, or we vision autism as a diversity of clinical conditions that change with time. The vast majority of them, the vast majority, make progress. Some, a lot of progress, some limited progress, but the condition changes with time. The second, the majority of them do not have full remission during life cycle. There's due to neurobiological causes, very often to rare or orphan diseases. The rare diseases is an important concept. The rare diseases are rare in one. But together, they represent all the population of Holland, Belgium, and Luxembourg together. So it's a lot of people having that. It's more frequent than usually considered. In the study that we finished, and we will be presenting tomorrow at the Congress, we had a sample of more than 1 million children 7 to 9 in Europe that we performed the study of prevalence in different countries, 12 countries with national registries and with field studies. And the frequency has some differences depending on the country, depending on the system, but it goes around 1. Some countries, 0.7 might be the average, 0.7, 0.1. If you talk about 0.12, that's the frequency of Alzheimer's disease. In the same way, Alzheimer affects the partner plus 2 kids, autism affects 2 parents and 1 sibling, 1 brother or sister. So you have to multiply by 3 the amount of people that their life changes. The difference is that Alzheimer happens after a long life, productive life. Autism starts at the beginning, and in the majority of cases go with you during your whole life. If you see the amount of money that is devoted to treatment and to research in Alzheimer's disease in Europe, has no comparison with the amount of money devoted to autism spectrum disorders. Much big difference. So you have to do that. It's associated with many comorbidities. We didn't talk about that, but there is a full conference on comorbidities of autism spectrum disorders. And we can partially modify with intervention, if wished by the person. With a new neuroatypical, we have people that say, I don't want to change. I'm happy the way I am. So don't make me a sick person. I'm all right. I'm saying, okay, fine. That's your choice. No problem with that. The vision of the person. We always consider the person before and above the disorder. I don't think I have seen autistic person, autistic child. We always say child with autism, person with autism. Although some people in the UK prefer to be called autistic person. In Spanish, sounds awful. It's like it's a schizophrenic person or something like that. So we didn't use that. We use the person. There needs a careful individualization that must tell us their wishes and dreams. The benefits from early support and may need the whole life. That requires especially support and that has rights and many rights for evidence practice. And I also have a vision of society that I know you must or you must not agree. But for us, it's important to consider an inclusive society. A society that values and promotes the social capital, not only the economic capital or the research capital, but also the social capital. that empowers the members to enjoy their rights, that develop inclusive programs in the community to guarantee participation, that searches for quality of life, preferentially in those in disadvantaged situations, and that innovates for the future of all people. So my message home for you, the lesson of our autism program in GIPUZKOA, are these 4 aspects. One is that you have to embed your program in the community, ensure interdepartmental support. And today we had people from different departments here, but it's very important to have interdepartmental support and embed the program into the community. Second, follow best practice guidelines. They're published, they're accessible. Third, search for outcome. Very often you'll hear, I do this, I do that, I do the other, I do that, and say, okay, hold it. What is the result? What is the outcome? How do you measure what you do? And the fourth is to empower the stakeholders, the persons with autism spectrum disorders and their families, to empower them. Don't do anything without them. And by the way, this order is not ranked in terms of importance. When I say 1, 2, 3, 4, it will be 3, 1, 2, 4, or 4, 3, 2, 1, or whatever. There are 4 things, but not in importance. Finally, you have to adapt. Very often people copy the programs. From the program from, I don't know, from Vermont, and put it in wherever, in Prague. It's not possible. You have to look at the context. You have to look at the resources. You have to adapt. You can learn the best from other people and then transform that into your situation and your practice. But it's very important that you recognize what you do and what you do well and profit from there. And everywhere in the world, there are people that do well things. So no problem with that. But we have to adapt. Okay, with this, I think I will finish the conference. Thank you.